Hello and welcome to the Headache Doctor podcast. Where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In this podcast, we're going to talk about kiddos with headaches or migraines. Why would your son or daughter have headaches or migraines, and what are some things you can look for to prevent it and then ultimately treat it? So we're looking at April moving into May, which is summer. Schedules change. Oftentimes families will feel summer is sort of a break from the sports, the other activities, the extracurricular, and then of course school. And so we tend to see quite a few more school-age kids during the summer. And we also see teachers. So whenever someone's freed up in their schedule for a period of time, they tend to hop on our schedule. And so the summer tends to be a big time for us with kiddos. And so what I wanted to do is create a podcast talking specifically about kids and some of the trends that we've seen in the types of headaches we're seeing in kids and why I think this is happening. So what I'll speak to initially is I guess I'll define what we typically see a child present with as far as a headache or a migraine. And demographic-wise, so these kids are typically middle school-ish, maybe early high school. They've probably had symptoms. Some of them will present with a relatively regular headache for a while, but most of them would have more of a debilitating situation and then potentially daily headache that would have gone on for, usually it's a few months before they come to see us, and they would have tried going to primary care, neurology. Oftentimes they're even admitted into the hospital and they do a series of tests and types of treatments in order to attempt to get the headache to break. So daily headaches are not uncommon in this younger population, in these kids that we see. And so we're seeing daily headaches pop up, but there's almost always a trend or a history of headaches that would pop up. You know, it could even be as infrequent as like a couple times every few months or something like that. But more commonly we hear every month, every week, or maybe a migraine every month. But it wasn't enough for the family to feel like, okay, we need to intervene and do something about this. And so by the time we see these kiddos, they can often have a daily headache. And those can be a little bit trickier to treat. And so we'll talk more about that. But a few things I want to highlight. All right, so when we're talking about the middle school into high school, and it can be both boys and girls, so it's not just that we're seeing a bunch of middle school, high school girls, although that's probably a little bit more prevalent, that these are young females that are presenting with these daily headaches. But I want to connect the dots between a few trends we see and then the reason these kids might be having these daily headaches. All right, so the first thing is when we get 12-year-old, 13-year-old, 14-year-old, however old, and even in high school, that is presenting with daily headaches, we have to understand that, and we bring the parents and the patient into this reality, that even though the headache may have become debilitating and daily within months, so maybe 2-3 months ago, the problem itself has likely been building over a much longer period of time, so over years. And so we have to step back and look at the big picture as far as what would lead to the scenario of tension building, a pain pattern of neck, jaw, shoulders, sending pain into the head to the point where it's now daily, and it's like a constant. It can be pretty severe in intensity, so 8, 9-ish out of 10. And some of these kiddos are able to push through and do school even with a high level of pain. But what's happening? Why would a kid go from getting a migraine a month or a couple headaches during the month to like all of a sudden they wake up and they have a daily headache? Now we do know that new daily persistent headaches or daily persistent headaches are a big problem. They're a problem in adults as well as children. And they often start with just a day that seemed insignificant. They start out of nowhere, and it's just from that day onward, you have a headache. It never really goes away. It might fluctuate in intensity, but it's always there. So there's not a day, there's not a moment where it goes away. You always have headaches, and they become very tricky to treat, very difficult. Oftentimes medication doesn't really respond, or the patient won't respond well to medication, and they'll try all sorts of different things but won't find much relief. Okay, so kiddos. I've done a podcast before. It's probably years ago by this point, but I've done a podcast before on kiddos, and the podcast was geared towards educating parents on why their kiddos would be in a headache situation. So this is going to be similar. Let me highlight some of the things that we understand in kids that puts them in potentially a higher likelihood of sustaining something like a neck injury that would cause a headache. So if you think of a baby or a toddler, their heads are disproportionately larger or proportionally larger than their bodies when you compare it to an adult. Okay, so our adult heads weigh 10 to 12 pounds, and proportional to however much you weigh, that's relatively I guess insignificant. I mean, it's the weight of a bowling ball. It's a lot of stress on your neck. But when you look at a child, their heads are going to weigh 7, 8, 9 pounds, and it might make up, like when they're real little, it might make up almost half their body weight. And so it's proportionally going to be a much heavier weight in relation to the circumference and strength of their neck and their shoulders. And so those little bodies are having a much harder time managing the weight of their head, okay? And that's by design, so it's not like, okay, we're flawed in that sense. But what it does mean is that we have to look at the body and at the neck as being more prone to injury if we put our necks in certain scenarios as kids, all right? And then if we combine that sort of instability, or the proportionally larger head, with a neck that's not fully developed, so the neck itself is not able to match potentially the level of stress that we put kids through with certain activities, whether it's sports, jumping on trampoline, whatever it may be, the fun things that kids do. And again, I'm not anti-fun with kids, but we just have to be aware of these things as parents. And so their necks aren't developed in order to sustain a level of stress that we potentially put their bodies through, and their heads are proportionally larger, heavier. Okay, so we have this dynamic as we grow and as we develop, where it's disproportional. We have to look at the neck, understand the weight that it has to carry as a factor of, okay, these stresses we put through our bodies or the bodies of our kids, is that potentially contributing? And so I would say yes, we have to be aware of it, okay? Something to be aware of. It's as if we were evaluating sugar consumption and then dental hygiene of a child compared to an adult. A child is not going to be able to potentially brush their teeth for 2 minutes, get the spots, aware of those spots, and then potentially they're more exposed to easier access to sugar. Maybe their sugar intake, processed sugars, are higher, and so their dental health might be at higher risk at a younger age. I think that's true. I haven't necessarily looked into that, but I would assume that that's kind of common knowledge, like kids are probably more prone to cavities. Anyways, just an example of where kids are at higher risk. The other thing that we're noticing is that we have seen a handful of these kiddos with daily headaches around the time that they are going through a growth spurt, okay? And so if you understand the physical mechanics of the body and biomechanics, so think like lever arms and forces through joints and muscles and how they attach. And so anyways, it gets into really just like physics, biomechanics, levers, and the lever arms changing. So in a scenario of a child going through a growth spurt and we have bones that are growing, what we know is that muscle tissue and tendons don't necessarily match that growth 1-to-1. So if the bones are growing and like elongating, lengthening much quicker than the muscles and the tendons, we see things like muscle aches and pains that pop up, or joint inflammation or tendon inflammation. So that would be, for example, like Osgood-Schlatter's, which is essentially inflammation of the patellar tendon in the knee. And so there's like the band that a lot of young athletes will wear in order to, allow themselves to run and but manage the knee pain. There's also the same type of thing in the heel. So again, where the calf inserts into the heel bone, essentially, that insertion point can get irritated as well. And then we're all aware of growing pains, which are essentially just aches and pains in the body as a child is growing rapidly, that we can point back to the musculoskeletal system. So like muscle pain, joint pain, tendon pain, things like that. So it's known from these other types of conditions that there's this mismatch in growth compared to muscle and tendon lengthening to be proportional to the bone growth. And that mismatch means that the child's more prone to aches and pains just in those areas, the added stress through the muscles and tendons. And then if they're in higher impact sports or activities, then those joints and muscles that are already under higher level of stress may be more prone to the types of aches and pains or inflammation that we would have sort of naturally seen just with their growth in that growth spurt. Okay, so when we're thinking of kids, just to summarize, relatively underdeveloped neck, heavier head compared to their bodies, and potentially going through growth spurts. All right. Now let's combine that with the activities that we put kids through, and maybe the sedentary lifestyle that a lot of kids have adopted, combined with school and what we ask them to do in school. Okay. So there's two scenarios here. When we're looking at good movement, healthy movement, what the body wants, we want variety, and we want, let's say, like a moderate level of intensity. And if we're going to go into higher levels of intensity of movement, we want to have trained for those so that we prevent injury. Okay, so those are just like basic principles of movement. And so when we get outside of those into the extremes, we get into higher levels of movement, higher intensities of movement, whether that's sports or gymnastics, potentially jumping on trampolines, things like that. The body might not be equipped to handle that. So we haven't built up what would be called a load tolerance for those types of activities. And so that mismatch of our body not being able to accommodate to those activities can lead to injury. And then we have the other side of the spectrum where it's the sedentary lifestyle. So we have a lack of movement, the absence of movement. And when we have an absence of movement, this is where I use the phone example, where you hold the phone up to your ear and then you realize your elbow is starting to hurt, so you have to straighten your arm out. That's telling you that joint doesn't like that you're not moving. And so that's one small example of the body telling you it wants to move. And so when you stop moving, there's aches and pains associated with that because it's not how our body's designed. And so the sedentary lifestyle and then adding stress or the intensity of the exercise or movements that we're doing, they can each lead to injury of the neck, jaw, shoulders, which will then lead to this type of head pain. So we have to evaluate both. So let's start with the higher intensity camp. So young females, it's going to be potentially gymnastics. We've got girls that are jumping on trampolines frequently. We have dance as definitely being one of those things that we see a trend. There's, a conversation of causation versus correlation. We definitely are seeing the correlation. I can reason into a causation of, okay, if we're whipping our head around our neck, if we're spinning quickly, if we're tumbling, if we're doing, backflips, if we're repeatedly trialing something like a skill that we're trying to develop and we're falling repeatedly, potentially increasing the amount of stress on the neck and the shoulders, those types of things we want to be aware of and understand that over time, it's not as if we can tolerate that unless we have some major injury or fall. It's the level of stress that is repeated, that our body is not able to accommodate to over time, that builds and then leads to these types of pain patterns. And so if you go to gymnastics, you could even actually, Addie, one of the patients that, one of the young patients that was a gymnast, she went to gymnastics and was tumbling. And I think it was like the next day that, she started to get this headache. So it's not even like in the practice. It can be delayed, and typically it's going to be, over a length of time. So you can't necessarily evaluate like, well, my son or daughter went to practice and felt fine after, so this probably isn't a big deal. No. And just to be clear, I'm not saying that these sporting activities or these, like even jumping on the trampoline, is always a negative. Okay. So we have a young girl right now that we're working with, and she continues to jump on the trampoline, but she's doing well. Okay. So we need to manage these things. We need to be aware of the risks that we're taking and then manage them. And that's why I'm talking about both the higher intensity types of activities, the higher levels of movement that our body can accommodate to, and then the more sedentary lifestyle. Because usually it's like we're doing both. So, we put our kid in some high level activity, and then they're at home, like on their laptop doing homework in bed for, 3 hours that night. So it could be that we're like not providing the actual therapeutic movement that our body wants and needs enough. And we have these two extremes that are sort of sandwiching our day and making it difficult for our neck to actually feel the way that it should, move the way that it should. And we're building up tension to the point where these kids are presenting with headaches and migraines. All right, so think about the activity your child's in. You don't have to quit that activity, but you just have to be aware of it and understand that if there's a connection between, increased headache after whatever sporting event or practice, that it's not a coincidence. Relate that to the activity. See if you can modify it. See if you can sit out of certain types of movements or modify the movement. Take a break potentially from practice. See if your child feels better. So just experiment with it. See how much of an impact it's having on their situation. On the other end of the spectrum is going to be a sedentary lifestyle. So my perception, I don't have kids that are school age, but I do interact with school-aged kids that have headaches. And my perception is that there's a lot of laptop work, and then typically they're doing maybe hours of homework at home, especially oftentimes it's the very studious students that we get in clinic with headaches. And so they're very dedicated to their studies. And so they spend a lot of time on their laptop, or it could even be a textbook. But essentially the idea is that kids don't need, sometimes kids will have like desks and proper setups at home. But a lot of the time they're just working from their bed or from like a beanbag on the floor or the couch or the kitchen table. And so they don't necessarily have a setup that's conducive for good posture and setting themselves up for success as far as being able to work for an extended period of time, doing their homework without building up tension in their neck. And so that scenario, and especially the working their bed on a laptop, like sitting, like Indian style, looking down, it's really rough. It's really tough on the neck. And again, they won't evaluate that based on like feeling anything in that moment in their body. They may have trained themselves to perceive that as comfortable and they kind of like it. So there may not be like an immediate perceived risk in those things or in the positions or postures. And so again, don't evaluate that based on like, okay, you've sat like that for 20 minutes. How do you feel? And they're like, I feel fine. No, that we need to understand that the body needs to move. So again, going back to the dental analogy, it wouldn't be like, okay, drink the sugary drink and let's just drink these sugary drinks for like, drink 3 or 4 of them today. And then if your teeth hurt at the end of the day, then we'll know they're bad for you. But if your teeth don't hurt, then it'll be fine. Like that's kind of what we're talking about. Like, no, like your body needs to have movement And if we're sedentary, especially in these poor postures that increase the amount of tension through the neck, we know they're not good for the neck. And so we need to get out of them. We need to provide our kids with a solution, a better way to do their studies or homework. So I suggest standing desks. I suggest they implement, like, whether it's some sort of pec stretch or neck stretch, or adding movement in, or walking, break up the sitting with those mild to moderate level of activities, so that they're giving their body the movement it needs, as opposed to just staring at a computer screen for hours. And it could also be like their phone. It feels like a lot of things are screen oriented, especially if your child plays video games. That's another tough one. Like if they go from homework on a laptop to playing video games, it's very, very sedentary. Maybe they, walk to school, or they play outside for an hour with their friends. If the bulk of their day is them sitting and being very sedentary, it's still a problem. And so that's why I say oftentimes it's a combination of sedentary lifestyle with the extremes of sport coupled together. And so you might think, oh, my kid's active because they're in volleyball or whatever sport it may be, but then the rest of their day is sedentary. That's not enough movement, and it's not that low level of therapeutic movement we want to get throughout the day. All right, so things to avoid or things to look out for on both ends of that spectrum for your kiddos. And so the scenario here is they've got this tension that's building up from both of those camps, so the too much movement and not enough movement. And then over time, so you're seeing signs of this. You're seeing signs of, okay, they're getting headaches every now and then, but it's not too bad. Okay, they're getting a migraine once a month, but we can kind of manage it with meds or that sort of thing. And then all of a sudden, it's like, boom, you have a daily headache. It's not going away. A lot of these kids have to go to the emergency room. They're admitted in the hospital. They try to get it to break. It won't break. And the really challenging thing is, when we get these kiddos, we have to communicate hey, this is going to take a while. This is going to be a process to get out of this headache, because basically the brain has been muting this pain signal and ignoring this pain signal for the most part, and then it hits a point where it acknowledges it and it becomes hypersensitive to it. And because it's been dealing with that pain signal behind the scenes for so long, it finally acknowledges it. It's going to be basically hypersensitive to it. And so we have to deal with both creating the environment, meaning reducing the amount of stress through the neck, which takes both us working on the neck, jaw, shoulders, but then also partnering with the patient. And kiddos sometimes are a little bit less compliant with doing what we ask them to do at home. But they need to be very, very careful that they're taking it seriously when we provide them with these suggestions and they make these changes. Because if we work on their neck, they very likely won't feel much change in their headache for a while. But if we work on them and then they go back to sitting, for 2 hours on their bed looking at their laptop, it's basically going to cause all of that, a lot of that tension to build back up, and their brain's going to be very, very sensitive to it. It's going to be hard to get out of that situation. So the little details matter in these scenarios with these kiddos, and then we need to address the underlying neck issue so that we can create an environment where the brain can then calm down and they can get out of it. But it takes a type of kiddo that's motivated, that understands this process. It's part of the reason we're recording this podcast, because we've seen more of these kiddos recently. And so we may be using this podcast as a resource to say, hey, listen to this podcast if you're a kiddo and you're having these types of headaches. And I'm highlighting one of the more common types of headaches that we see in kids, but it's really, we see the whole gamut of things. It could be monthly migraines, more frequent migraines, tension type headaches, whatever it may be, whatever you're dealing with. We've even seen silent migraines and autonomic dysfunction, meaning increased heart rate, fatigue, that's chronic without any sort of pain at all. That be related to neck issues as well. So all sorts of kind of odd things. Stomach pain, constant stomach pain that fluctuates, that increases when they eat. All sorts of stuff that once we clear up the dysfunction that we're seeing and the stress that's placed on the neck, shoulders, jaw, it clears up. So there you go. If you're a parent and you have a kiddo and you've been trying to solve this problem, you landed on this podcast. If you're in Colorado Springs or Denver or Parker, anywhere in Colorado, really, come see us, and we'd love to help you out. If you're out of state, you're looking at our virtual coaching. The last podcast I recorded with Sorrel is a fantastic resource if you're looking for encouragement in that direction with the SAM device. If you're not familiar with the SAM device, go to our website, look it up. We've got video content. You can purchase it right on Amazon. The link's on our website as well. And that's a quicker way to have an aspect of what we do. That won't replace our treatment. You need to definitely reach out to us so that we can help you get across the finish line. But especially if you're out of state, virtual coaching and then access to the SAM device is a great avenue. Thank you all so much for listening to the Headache Doctor podcast, where as always, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your neck, headache, or migraine and dependence on medication. I'll see you next week.